Hello there. I'm Dr. Shiroko Sokic, and I'm here tonight to talk to you about heartburn and reflux. And today, so there's a lot of people who are struggling with reflux and issues having to do with heartburn. And it's a common problem. Up to 25% of the population in the United States has heartburn or reflux at some time. And, in Western medicine, we think of it mostly as an issue that had with too much stomach acid. And in Chinese medicine, there are many other reasons that you might have heartburn or that you might have reflux symptoms. And I'm very successful at treating it. So I'm going to talk to you about some of the possible causes and some of the things that you can do. Actually, as you get older, one of the very common causes is that you have not too much stomach acid, but not enough. So when you have not enough stomach acid, even if you take some of the medications that are commonly prescribed, such as, I can't remember, Tagamet and Zantac and Pepcid and omeprazole and things like that, you may take those medications and they may give you some kind of relief, at least temporarily, even if you have a low stomach acid. And you can figure that out by experimenting. But one of the ways that you can get a lot of relief is if you stop eating certain foods. And the foods that are most likely to cause an issue with heartburn and reflux are things like white foods, like white bread, white rice, sugars, too many starchy carbs, especially late in the evening. When you eat too many starchy carbs, you're more prone to have your food kind of ferment in your stomach and not be able to move forward, especially if you don't have enough stomach acid. You might be more prone to get food sitting in your stomach not digesting well. Another cause that of heartburn or reflux symptoms can be, of course, that you have a bacteria called H. pylori, and that bacteria causes stomach ulcers. And I've seen it in a lot of my patients where maybe they don't have an ulcer, but they have this low-grade stomach discomfort all the time. And when we find the H. pylori and we treat it, that stomach discomfort goes away. So that's another possible cause of reflux or heartburn is H. pylori. I had one patient actually a couple of years ago, and he had been diagnosed with H. pylori by his doctor at Kaiser, and he'd gone through a course of treatment usually in Western medicine, it's triple antibiotics that you use for H. pylori. And he had gone through that course of treatment and his symptoms didn't go away. But when they retested using their tests, he didn't have H. pylori anymore. So they just said, well, no more problem. But then when he did a special kind of stool test, I do a special kind of stool test that looks for the DNA of critters. And sometimes you find more. You can find them hidden. And he still had that bacteria. And then when we treated that, it changed his whole life. He got better. He lost weight. He started feeling better. So H. pylori is another possible cause of heartburn or reflux symptoms. Hi, you guys. Nice to see you all. George, Abigail, Tom, Rachel, hey, and Heather. Nice to see you. Anyway, so another potential, so there's several other causes of heartburn. So I've already mentioned not enough stomach acid. Second one being H. pylori bacteria that causes ulcers. And third one being hormonal shifts. So around perimenopause for women and other times of life for men, there are certain hormonal shifts that can affect your digestive function, and it can affect the amount of stomach acid that you produce. And part of that is because the adrenal hormones, especially cortisol, affect your pancreas function. And your pancreas is the organ that helps you digest your food. And so when you eat food, it comes into your stomach, and then it's supposed to break down in your stomach using stomach acid. And then it gets passed into the small intestine, where you're supposed to have digestive enzymes that help you break down the food even further. And then it goes down along the small intestine and continues to be absorbed. The food gets absorbed and broken down, and absorbed and broken down, different components of it broken down and absorbed in different locations. And when the pancreas isn't working well, and the pancreas's job is to release digestive enzymes like pancreatic enzymes, it's also supposed to release insulin. And so when you have too much cortisol, which is an adrenal stress hormone, and when you have too much cortisol, then that affects the amount of stomach acid that you produce. Or when you have perimenopausal other hormone shifts, that can affect your cortisol level, and then that can affect the amount of stomach acid that you produce. So hormone shifts can make a huge difference. And that's why it's fairly common during high stress times, like a lot of us are living in right now, where you may have more heartburn. Of course, we're also craving foods that that are kind of comfort foods, and that can, of course, cause heartburn as well. So the fourth cause of heartburn is the foods that we eat. So, and anytime that I work with somebody who has heartburn, I have you change your diet drastically, or maybe some people may already eat that way, but I have you take away all of those comfort foods, the white foods, the potatoes, the sugars, the starchy foods, especially in combination with other foods, can cause the food to sit in your stomach and sort of ferment there. Hi, Melissa. Nice to see you. Hi, Chris. Hi, Ben. Hi, Judy. My goodness, it's nice to see you all. And so anyway, when you have heartburn or when you eat those certain kinds of foods, you're more prone to get heartburn as well. There are also other digestive issues that will cause, so have you heard of SIBO? SIBO is small intestinal bacterial overgrowth. And when you have small intestinal bacterial overgrowth, what's happening is that the small intestine has a whole bunch of bacteria sitting inside of it, and then that can cause irritable bowel symptoms, and it can cause gas and bloating and digestive discomfort and difficulty losing weight. So there's a whole bunch of symptoms that go along with small intestinal bacterial overgrowth. And one of the causes of SIBO is not enough stomach acid or not enough motility, so your stomach not working correctly. And so making your stomach work correctly is important to help you heal your small intestinal bacterial overgrowth. I have another patient who is actually quadriplegic, and depending on where the problem is, the fourth cranial nerve, or sorry, not the fourth cranial nerve, the fourth cervical nerve, where the vagus nerve comes out, if the information from the vagus nerve is interrupted to your stomach, then that can also cause problems with your stomach. That's not as common, obviously. Actually, major trauma that's not quadriplegic or not having had a major neck trauma can cause your vagus nerve to be an issue. There's a summit going on right now that's talking about how the vagus nerve works somewhere on the internet. Anyway, the vagus nerve is vitally important to your digestion working well. So your digestion needs to be, or your nervous system needs to be in a state of rest in order for you to be able to digest. Rest and digest. And if your nervous system is on hyper alert, or if you're super stressed, then digesting isn't on the top of mind for your nervous system. These are some of the main causes of heartburn and reflux kinds of symptoms. And there are different ways of treating everything. So there's one other thing in Chinese medicine, or there's two other things in Chinese medicine, actually. In Chinese medicine, how the liver works is that it regulates the smooth flow of energy in your whole body. Excuse me. And so that's one of the many functions. But when the liver is not functioning smoothly from the perspective of Chinese medicine, so remember this is not the same as Western medicine, then the liver will impinge upon your stomach, and then you'll be more prone to heartburn as well. And so that would be a situation where maybe you were really stressed, another possible stressful situation. And what we would do with that then is use Chinese herbs and acupuncture to help correct that. Actually, I use Chinese herbs and acupuncture to help correct any of these symptoms. So that's how I would help somebody in these situations. And the other issue in Chinese medicine would be something called stomach fire. So stomach fire is sort of the same as the classic heartburn that we know in the West, where you have too much stomach acid. There are actually some people who have heartburn who have too much stomach acid. And in those cases, the medications that we have in Western medicine, such as that I mentioned earlier, like Zantac and Pepcid and omeprazole, things like that, those medications would work in that situation because they would actually stop the acid production or help slow the acid production. But from a Chinese medicine perspective, what we would do is we would calm the fire in the stomach. And then the one other cause is where people have what's called a hiatal hernia. And what's happening there is that the muscles of the diaphragm, so the stomach is right under the diaphragm. And when you have a hiatal hernia, what's happening is a part of the stomach is, so at the hiatus, the top part of the stomach is pushing up into the diaphragm. And so not all of the food is able to get into the stomach. And then some food gets stuck up inside of the hiatal hernia. And there's lots of ways of moving it so that you can get rid of it. I would do a demo now, but I'm not dressed for the occasion, so I can't give you a demo of how to get rid of a hiatal hernia. But one of the things that you can do is just, one of the things that they say that you can do is, like, first thing in the morning, you could drink a lot of water and then kind of jump up and down, and that would pull the stomach down from where it's being stuck. So that's one of the treatments I read about. I did not actually try this on anybody. Another treatment for hiatal hernia would be to actually pull the stomach down from where it is being held. And so a lot of chiropractors do this. There's a treatment called a diaphragm release that is an osteopathic manipulation treatment where I or some practitioner can hold your ribs, and then you can relax the diaphragm, and then the stomach can go back to its position that it belongs in. A couple of other ways of treating reflux that are common to all of the different possible causes is that you can, I've actually had heartburn off and on a fair amount in the last few months. I think part of the stress of the COVID and all of that has me not eating as well as I usually do, and has had me and some worrying at night or eating too late at night. Sometimes that will also cause the problem. So what was I going to say? Another treatment. So one treatment that really makes a difference is if you chew your food well. Now, I'm sure you learned this when you were a kid, that if you chew your food really well and you eat slowly, it helps your digestive process starts inside of your mouth. There are enzymes inside of your mouth, and when you chew your food, you're actually breaking it down into digestible bits. So one of the things that I started doing when I had heartburn in the past is that I started chewing my food really, really well and really slowly. And it's amazing. It doesn't take that much longer for you to eat your food, actually. You should try it sometime if you haven't. But it makes a huge difference. I like literally within a couple of days of chewing my food better, the symptoms went away. Now I get my symptoms usually when I eat too much white food. That's what causes me to have heartburn, is like either eating bread or potatoes or rice, too much starchy food. My addiction, of course, is sugar. So sometimes I eat sugary foods and that will cause heartburn. Oh, hi, Colleen. Nice to see you. Oh, Suzanne. Nice to see you guys. And Carrie. If anybody has questions, please feel free to ask them. We're coming close to the end of my level of information. So if you have questions, type them into the chat box there. Chewing food well. So like literally count 20 chews before you swallow. And actually it changes the experience of eating if you do that. So when you chew your food really, really well, and then you swallow it, it takes a little bit longer, but it also creates almost a meditative practice. So a lot of times people are in the habit of either watching TV when they eat or doing something else when they eat. And one of the things that it helped me do was it helped me to just kind of slow down and pay attention to the food that I was eating and being more present with it. And it seems that right now in our lives, life wants us to be more present with what we're doing and paying more attention to so many different details in our lives. And one of them is how we eat. So that would be something that's worth trying. If you have heartburn first thing in the morning on an empty stomach, that is really because you probably have too high a cortisol level. So cortisol is the stress hormone that's produced by your adrenal glands. And when you have when you're sleeping at night, you're supposed to have a low cortisol. And first thing in the morning when you wake up, your cortisol is supposed to come up. Now, so one of the sleep problems that people have very commonly is that their cortisol levels are too high at night. Sometimes they'll start to go up late, like 3 o'clock in the morning or 4 o'clock in the morning or something. And then when you wake up in the morning and your cortisol level's too high and your blood sugar's kind of low, then what's happening is that causes your stomach to produce more acid. And so then you'll have heartburn from that. Either that or you ate too late at night and you ate the wrong food late at night. If your cortisol is the cause of you having heartburn when you first wake up in the morning, a lot of people who have high cortisol, so this is another symptom of high cortisol, you'll have not heartburn, but you'll have nausea first thing in the morning, and you say, oh, I can't eat anything because I don't feel good in the morning. Well, you are actually the person who should eat within 1 hour of getting up in the morning. So if you have a high cortisol, what you need to do is eat a high protein meal first thing in the morning within an hour of getting up. High protein, not carbs. So like a protein shake with nut milk or something like that, or eggs, if you can tolerate eggs, or even, I hate to say this because people will take it out of context, but bacon, you could have some bacon and eggs, but just protein. It will, over the course, it usually takes only about a week. It's like over the course of a week, what will happen is it'll start to shift your cortisol levels so that first thing in the morning you won't have a high cortisol, and you should have a change in whether you have heartburn or not. So that's for you, Chris. Hi, Barb. Nice to see you here. And Terry. Oh my gosh, Terry. Hi. Anyway, let's see. Let's see if I have anything else to tell you. If you have more questions, just please ask. One of the common questions that I get asked is, how late at night should you eat? And ideally, so another thing that will help your stomach actually and your small intestines heal is depending on the state of your adrenals. So if you have a high cortisol or if you have adrenal fatigue, this isn't for you. So don't listen to this part. But if you're a person who has tends to have high blood sugar or almost anybody else can do this, do a period of fasting where you give your stomach a rest. And you can do the fasting from between 12, 14, and 16 hours a day. And so how you do that is you eat your last meal fairly early in the evening and you don't snack at all night. And if you have reflux, that's what you should do. You should have your dinner, let's say at 6 p.m. and then not snack. And then first thing in the morning, you could have breakfast if you want to do a 12-hour fast. If you want to do a 14 or 16-hour fast, then what you do is you eat later in the morning. But again, if you have a high cortisol, you can't do that. You have to have your breakfast first thing, and then you would have your last meal later in the day. So you would have a 12-hour period at minimum of not putting anything into your stomach. And that allows your intestines to rest. And shockingly, there's a lot of research about fasting and the benefits of fasting and the different benefits of intermittent fasting, among them being blood sugar is improved and digestion is improved. People who fast even longer than that can heal whole digestive issues. And it seems that by letting your stomach and your pancreas get rest, it resets it. And then that helps it function better the next time it is called upon to digest food. Okay, so if nobody has any questions, let me think if I have anything else to say. I love that you're all here. It's great to see you. Let's see. So there's a couple of different symptoms with heartburn. One is that you get your heartburn before you eat. And another is that you get your heartburn after you eat. And they mean different things. So if you get heartburn before you eat, that would be that you would have heartburn on an empty stomach. And then that could be because that there's irritation inside of your stomach. So there is another cause of heartburn, and that is when you take certain medications. Like I'm super sensitive to Advil or Aleve, those anti-inflammatory medications. And my tolerance is maybe 1 in the course of a period of pain, and I could have a period of pain for any length of time. So if I have to choose when I take something like that, because it will give me heartburn after the second dose, because it burns the stomach lining. So that's one of the problems with aspirin and ibuprofen or Aleve, things like that. They are anti-inflammatories, but they also burn your stomach lining. And so you can get something called gastritis, which is inflammation of your stomach lining. So that's another possible cause of heartburn. And that usually will go away fairly quickly. Like if you stop irritating your stomach, then the symptom will go away. It makes pretty good sense, right? But that will usually go away in like a couple of days. Okay, well, if no question, I'm just going to search here a little bit. Hi Magdalena, how are you doing? Beautiful. So I'm just reading this comment just to see if there's a question at the end of it. No allergy symptoms. Thank you. It's great to see you too, Magdalena. It's wonderful. You're in Texas. Great. Chris, you're asking if your supplements could be bringing this on. Yes, you can actually, you can have heartburn from taking too many supplements or too many pills. You can have heartburn from eating too much food. You can have heartburn. Yes, you could have reflux and you could have cortisol causing heartburn in the morning. So yes, you could have a multitude of reasons for having heartburn. And then of course there's one other thing. So I'm just going to add one other thing because I always think of something late in the day here. But there's also emotional connection. So you know that I work with both Chinese and Western medicine, and the stomach and the spleen. The stomach and the spleen are the organs that regulate your ability to digest your food. And so you take in your food and it goes to your stomach. Your stomach's job is the pot that cooks the food. So if your stomach's functioning well, then you should be able to put food into it and then it would process it so that it then can be digested, which is how that works. And the spleen's job is to transform it into energy and transport it to the rest of your body. It also regulates the emotion of worry, the strength of your muscles, your ability to concentrate, and it makes the blood, which is the same, making the blood is the same as the job that the spleen has in Western medicine. And so if you're worried a lot, or I've also already mentioned that the liver can cause an upset of your digestive system because it can get excessive. So when your liver's energy is too excessive, it kind of invades your digestive system, the spleen. So the liver rules the emotion of anger. So if you're worried a lot or you're angry a lot, then it can affect your stomach and it can cause you to have problems with your digestive system. So that's another aspect of the thing. And if you've read my book, Healing When It Seems Impossible, 7 Keys to Defy the Odds, let me put in a little plug for that right here. If you read my book, then you could find, oh, George, you're so funny. Yes, it's a bad idea to have ice cream just before bed. And thank you, Abigail. Yes. I understand what you're saying. Yes. Anyway, so if you're angry a lot or you're worried a lot, and of course, again, in these times, a lot of us are worried about all kinds of things, it could affect your stomach. So those are the emotional connections. And in my book, there's a whole chapter on how the emotions affect your physical body. But it's a two-way street. So you never just blame your emotions. You never just blame your body. It's a two-way street. Everything kind of goes together. So when you have a set of symptoms, kind of try to look at it holistically. Like, what are all of the possible things that can affect you? And the first and last thing to do is to just start with cutting out the starchy white foods first, and alcohol and coffee, of course, because those are foods that can irritate your stomach when it's already upset. And then to chew your food really, really well and eat it slowly. And then give me a call if you have any other questions. Oh, January, nice to see you guys. Okay, well, if there's not any other questions, I'm going to hang on for just one more minute and just say hi to you all. And then if you have more questions, I will come back to check this video later and see if you need anything. Hi, Ruby. Okay. So I hope you have a wonderful evening, and I'll look forward to doing this again in a couple of weeks. I think I'm going to continue the theme of heartburn and digestive issues. Nice to see you, and have an amazing evening. Mary, how you see this again is that it's going to be posted. It's on my page, and all the Facebook Lives are at the top of the page, so you should have no trouble finding it. Okay? All right, thank you so much. I'll see you soon. Take care. Bye-bye.